gut. The second part, management. Okay. So to make it simple, let me go through the changes that occurs in a person having a gut problem. So let's go back to the S-Tribe report. But before this, what I do for training for doctors is, I have one module on electromagnetic frequency that will take around an hour plus. One module for vitamins, there are 16 vitamins. I need to go through each one of them, second module. In this way, we have I have around 10 modules. After the 10 modules, we go into 5 specific modules. One of them is the gut. Second is the cardiac. Third will be diabetes. Fourth will be metabolic syndrome. The fifth one will be thyroid. So this is part of the broader subject. Gut health takes 4 hours, but I'm trying to complete it in 2 hours in a very simplified manner. So the changes that takes place in our gut, let's go to the changes we see in the vitamin page. Among the 16 vitamins, I will go down to simpler ones or the most important ones and how to interpret it. Okay. So if we were to look at vitamin B12 is one of the most important indicator in a gut health. Vitamin B12. So the way we look at it is very simple. When we see a vitamin B12 deficiency, this is how, as a doctor, this is how I look at it. Okay, this is a gut. You're having food, okay, and the food goes down and it absorbs, let's say, vitamin B12. And it goes in here, and in the gut, it is lined by some cells called parietal cells. The function of parietal cells is to release hydrochloric acid, and it also has got intrinsic factor. Intrinsic factor is required for absorption of vitamin B12. So when we are seeing a vitamin B12 deficiency, it means that either there's a deficiency in the food they're taking, or there's a problem going on here. And the third problem can be from the intestines. Okay, that is how we have to look, not a vague report to say there's a B12 deficiency. It must mean there's something in the body, there is a location that is causing a deficiency. So we need to ask history that what is the type of food they eat. Usually B12 is mostly from animal source or fortified food. And if it's not enough food intake, it can be problems like, it can be problems like taking antacids. A lot of people have gastric problem, they'll be taking antacids. Second, it can be due to gluten. 3, it can be a vegetarian. 4, it can be infection that is going on, like H. pylori. Okay. 5, they have been on medications. So we need to understand that there are factors that's influencing. The other problem can be an absorption here. So the way I look at it is, this is how I look at it. It's a 3-dimensional approach. So don't simply say, oh, B12, and we take this, take that, take this. First, we have to rule out all these factors before we supplement. Even if you were to give a B12 vitamin, it may not be absorbed because of the gut lining or something is blocking here. Okay, so that is B12. The next important factor affecting the gut in a person having gut symptoms is vitamin D3. So the way to see how a vitamin D3 deficiency appears in the body, we are looking at a report, but in our mind, we are looking at a very different way of looking, like an X-ray to a person. So the way to see it is, you draw this diagram in front of a client, and he's eating food, and is supposed to absorb vitamin D3. So he's getting digested, and he's supposed to absorb D3. D3 is absorbed into a blood vessels. So you have D3, D3, D3. D3 goes into liver. And there it is converted as 25 hydroxy D3. And then it is now transferred to the kidney as active component called 125 hydroxy D3. So if there's a deficiency on a report, this could be one possibility, this could be a second possibility, this could be a third possibility, this could be a fourth or fifth possibility. The other factor is most of us are now staying indoors a lot. So there's not enough absorption of D3 through the sun. So there's another way, is this is the sun, and we absorb through the skin D3. It comes as 25 hydroxy D3. This is not active, this has to be converted to active component. So when we are seeing a report, a D3 deficiency, it means in our mind it's like a computer. Okay, it could be that food is not taking enough, is not absorbing well, or something wrong with the liver, and something wrong with the kidney. For that reasons, the next step we have to do is to do blood results. Okay, not simply give a vitamin D3 in the form of tablets or injection or some supplement. It will not work. In the presence of toxic metals, it will not work. In the presence of kidney diseases, automatically the person may have a vitamin D3 less deficiency. Or he's having a liver disease. It's not converting. Or he's got a poor absorption. This could be related to a malabsorption or a colitis. It could be ulcerative colitis, Crohn's disease. It could be due to so many other reasons. But important is when it comes to having symptoms, do not manage. I strongly suggest you to get a doctor to assess, get a scope done, or OGDS or a colonoscopy to rule out cancer or polyps. Okay, a nutritional report. Intelligence is this. This is what I'm talking about, alien intelligence. In countries where winters are prolonged, they are very deficient. 80% of the world population, in spite of having been in the desert, we are having vitamin D3 deficiency. That is how we have to look at D3. So what is the next most important deficiency we find in gut health? We have vitamin C. Vitamin C. Vitamin C half-life is around 2 hours. The moment you pluck vitamin C, some part is lost. The moment you cut an apple or orange, vitamin C is lost. When you cook, it is destroyed by heat. So if a person is always a meat eater, most likely you're not getting enough vitamin C. Vitamin C, don't try to decode into different sections. Vitamin C is vitamin C. Don't go beyond that. So these are the most important deficiencies that I find in a case of in the vitamin section. So let me take you to the other section called minerals. Under minerals, most common minerals, okay, will be zinc. Okay, how do we express, or how do we tell a client what is zinc deficiency? Okay, how does it occur? So if you take the gut, you're taking food. Okay, let's say it converts to glucose, enters your body, and glucose is here. Glucose enters into the body, into the blood vessels, and you have glucose here. Once glucose is released, insulin is released. Insulin requires zinc to transport insulin from the pancreas into the bloodstream. You require zinc. Zinc, it can mean many things. It can mean zinc is required functions, required for immunity. 2, required for intestine lining. 3, required to reduce blood glucose. 4, zinc is also required for hair growth. 5, insulin can, zinc can also represent that you have cadmium toxicity. So when we are seeing a zinc deficiency, not necessarily that is the only part. This is how a diabetic I see. But when you're finding the zinc deficiency, these are the factors that you have to look at, right? Second most common deficiencies I see in the gut health. There are 16 vitamins. Okay, the other deficiencies you will always find is iron deficiency. Iron deficiency can mean so many things. It can mean you have a red blood cells requirement. It can mean that you're having some form of intestinal stress. It can be oxidative stress. So this is the other common one. The other common deficiency I see is iodine deficiency. Iodine deficiency is basically that this is our brain. Brain sends a signal called TSH, thyroid stimulating hormone. It activates a hormone release from the thyroids. This is our neck. This is thyroid. This is the neck. So it releases a hormone called thyroxine. Thyroxine releases a component called T4. It has to be converted to an active component called T3. So this person, when you're looking at it, the person may not be symptomatic, but it means that he is subclinically hypothyroid. But in the gut, 20% of T4 is converted to T3. So when we don't do a gut clearance, most likely you are developing a subclinical hypothyroid. So no matter how much of thyroxine we give, we are not correcting it. So there's a certain percentage. This is how I look at things. Where is the deficiency coming from? How is it is forming? What is blocking this? Okay. Then the other common mineral deficiency is magnesium. Magnesium indicates that it could be is required for your heart. In the heart, this is your blood vessels. Is required for vasodilatation to help you relax. So a person who's hypertensive may be having a deficiency of magnesium. It can also mean it's a neurotransmitter. It's required for sleeping, or it relaxes the brain. Okay, it also helps to reduce blood pressure. Okay, and it also means that you're losing bone. So we have to go person to person, not simply blindly interpret, or these deficiencies, these deficiencies. No, it doesn't work that way. Okay, the other common thing that I find in gut disorders. I'm specific about gut page. This page has been developed by me, and I'm talking about what are the common problems that appear here. Okay, the other is sulfur. Sulfur is required for bone, and you see persons with allergies or skin problems. It's common. Or you're finding someone who's aging, or someone who's having osteoarthritis or osteomalacia. Okay, so these are the common problems we see in a gut disease disorders under mineral page. Next, we go down is omega. Under these, most common, we will do this way: omega-3 and omega-6. Omega-3 main function is anti-inflammation. This, if it's excessive, omega-6, it is pro-inflammation. So in a report like this, when there's a chronic inflammation that's going on, most likely you're likely to find omega-3 deficiency. And let's say you have omega-3 deficiency, and this is adequate. It means that there is an inflammation going on, and you're not protected against a pro-inflammatory factor like omega-6. So chronic inflammation is what leads to chronic diseases like hypertension, diabetes, cancer, rheumatoid factors, an inflammatory process like autoimmune, which is going on. So you're most likely to find this. Okay. If you are above 50 years old, how to prevent Alzheimer's? Okay, if you look at Mediterranean diet, they are more into omega-9. So you need mostly omega-3 and omega-6. 9. That protects your brain. Okay, the next chapter is antioxidant page. This page is very interesting. Okay, I'll make it very simple. Let's say you have a zinc deficiency. Okay, let's say you have a zinc deficiency. And let's say this is your intestines. And zinc, we can get it from nuts, seafood. And you're supposed to absorb zinc, and you find zinc deficiency here. So no matter how much of zinc we take, it's not absorbed. This is about bioavailability. And sometimes you'll find zinc deficiency at the same time in your mineral page. You find zinc deficiency in your mineral page as well as your antioxidant. It means that in your cell level, there is not enough of zinc. So it requires a three-dimensional approach rather than to see this deficiency. I want to replace this. I want to replace that. Body does not work that way. Body works on something called crosstalk. What is a crosstalk? Crosstalk means that I got a severe headache and I don't feel like watching TV. I don't feel like eating. And I don't feel like speaking to anyone. That is crosstalk. That is brain is talking to so many things connected around it. So body speaks to many parts of the body and acts together. So we're trying to give a single component, does not work because the S drive is a human data and is giving exact intelligence to us. So don't look at individual and say why this deficiency is occurring. I'm not God. The body is telling us that there's a deficiency. Don't question a report. You got to understand the intelligence that I signed over the past 5 years. Doctor, I expect this to come. It's not coming. That's vague. That means you're seeing something at the biochemical and expecting it to happen. It does not. Okay. So as it appears, you convert that to intelligence. Okay. So the most important part in these that I find is one of them is sulforaphane deficiency. Sulforaphane comes from broccoli or cabbage. And it's a very powerful antioxidant. It gives you a component called glucoferrin. This converts to a component called NRF2. NRF2 is nothing but that this is a cell and is entering into the cell, into the nucleus and coming out at approximately 180 minutes, and is a very powerful antioxidant. So if there's excessive stress, it goes in every 80 minutes and is very, very specifically targeted for antioxidant, and it protects against pancreatic cancer. And it's also part of anti-aging. Okay, do not take advice from what I'm showing you because it's individualized. I'm just giving a general page. Gut topic for doctors is a 4-hour topic, which I'm squeezing up for 2 hours as a brief understanding of what we are looking at. Okay, 4 hours because I'm facing doctors who are extremely intelligent, very talented, and multidisciplinary. You can never interpret this to a disease. So whatever deficiencies you're seeing, please, on a report is not equal to a disease. Please. Don't equate a deficiency to a disease until I say so. Okay, I'm an evidence-based doctor, and I've been asked this question many times. Can you see cancer? Can you see this? Can you see that? No, do not use this as a diagnostic tool. It's just a screening device. It's a nutritional screening device. You need to have other information to ultimately tell whether you are having diabetes or hypertension, or these can be protected to it. Never equate a deficiency to a disease. The other common problems that you see is CoQ10. 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 CoQ10, by the time we are 40 years old, most of us have come down by around 50% in our body, CoQ10. So if you find, I have not seen a medical test that is done, unless it's exclusively done for CoQ10. Okay, CoQ10 has got many components and is mostly is concentrated in the heart. Heart has got the highest amount of CoQ10. Heart. Don't interpret a CoQ10 to a disease. CoQ10 is basically about energy. And heart is one of the places where the highest concentration of CoQ10 is required. Okay, so if a person is having a hypertension and a CoQ10, that is required for heart. If you find a lot of these antioxidants going on and a CoQ10, it means oxidative stress. So we have to interpret separately. What I have done with doctors is a 4-hour topic, so we'll be having an interactive session, not a Zoom call like this. I'm just giving a basic understanding of how it appears in gut. Second, the other common factor that I see is selenium deficiency in gut-related problems. All the past half an hour I'm explaining, all of them are related to gut. For heart, it's a separate meaning. For immunity, it's a different meaning. So this is purely related to the heart. Selenium is required for immunity. Is required for, is also required for gut health. It can also mean that you're having mercury toxicity. So I'm in Malaysia. The time now is approximately 2:30 p.m. New Zealand time is 7:30 now, and Australian time is 4:30 at the moment. I want to explain to you this again. Nowhere in the world currently, I'm claiming this. At a click of a button, it shows all these indicators what's happening in the health. We can go and search on the internet, you'll never find. This has been developed after 5 years with a team of doctors. We have done correction and thousands of people have improved. So here I'm not running on theory. This is pure practical. Nowhere on internet you'll find this. So that means this is global first, world's first. What you're witnessing is the world's first information that at a click of a button that you can find what's going on. And we can do a corrective step backwards. We work it backwards, not the frontwards. And never equate anything that you find to a disease is wrong. Okay, unless you're managing a patient like me, doing blood tests, scope, urine investigation, blood investigation, CT scan, or ultrasound. If you are not in that field, just take it as nutrition and help to understand. Okay, so the other common deficiency I find in the antioxidant page, alpha lipoic acid. Alpha lipoic acid. This basically means it's a very powerful antioxidant and it's removing toxic metals, chemicals, and others, and inflammation. That's all it means. So from here, we skip on. The other is the main important thing is here, we regularly find is superoxide dismutase. This I will come towards the end. A very common finding, superoxide dismutase is meant for removing oxidative stress. Then comes the amino acid pages. So there are 25 amino acids. In the 25, 11 are called essential amino acids. And the 14 are called non-essential amino acids. Non-essential amino acids body can make by its own. This we have to take it as food. Among these, the commonest I find in relationship to the gut page is histidine. Histidine. Histidine is histamine. Means you are having a leaky gut. Okay. The other common is tyrosine. Tyrosine means is affecting your thyroid. Okay. The other common amino acid deficiencies you find is glutamine. Glutamine is for the liver, for detox, and also this is one. Number two is the intestine. It is the main energy for the intestines. Okay, 1, 2, 3. Okay, for example, I give you an example. Most of us may have alcoholic fatty liver or non-alcoholic fatty liver. Fatty liver, we can only diagnose using an ultrasound or a biopsy, but I can decode from an S drive. Okay, how does fatty liver appear? I'm in a meeting. Okay, so fatty liver. If you have methionine deficiency in a report, and it converts to homocysteine, homocysteine converts to methionine, and if you look under vitamin, you'll have betaine deficiency, or is also called TMG, and we have vitamin B12 deficiency and a B9 deficiency. It means that you are having fatty liver. This could be because of your alcohol intake, gut producing alcohol, bacteria producing alcohol. It can be toxic metals, it can be chemicals, it can be gluten, it can be viruses that is causing fatty liver. As a doctor, I can tell you, but as a nutritionist or a naturopath, please do not go into this kind of diagnosis for reason is you need to have a complete big picture before we can say the person is having a fatty liver or non-alcoholic fatty liver. Okay. Because once we were to declare the person is having fatty liver, my question is, show me the proof. So the only way to prove an evidence is to do an ultrasound. Otherwise, do not make diagnosis, please. Just follow that this is a nutritional deficiency causing some form of liver. There is no clinical signs or no symptoms for liver diseases. Okay. Next, we come down to this page. Toxic metals, chemicals, and radiation. This is where I find most of the problems associated with the gut. Number one is toxic metals. In toxic metals affecting the gut will be mercury. Number two, arsenic. Number three, lead. Number four, aluminium. Number five, cadmium. Number six, nickel. This affects the gut. As long as you have this gut page and it shows toxic metals, no amount of correction will help this to overcome. Okay. Then comes the next part that affects the gut is chemicals. All kind of chemicals are affecting the gut. The other one is radiation. Anyway, radiation has got two components. You have a direct or ionizing radiation like X-rays or atomic bomb, or indirect through breakdown of uranium products like radon, thorium, lead. Those are the indirect products that are actually part of the radiation that can affect gut directly. Let's go to the next page. Resistance page. The number two cause will be bacterial overgrowth. Bacteria. When we have bacteria, whether it's a borderline, this is borderline presence or full presence, it means that the end product of this is called LPS or lipopolysaccharide that causes inflammation, low-grade inflammation, and that causes diseases. Okay, that is the main factor that affects the gut. Number one in the gut. Number two in the gut. And second part will be the fungus. Fungus, if you look at the intestines, if you have yeast here, no problem. But once it sends a hyphae, these will attract macrophages. And it sets off a series of inflammation markers. For that reason, we have to be careful about fungal overgrowth. The next one that affects the gut is the parasites. Parasites is a common commensal in most people and is something that's very difficult to get rid of. So many times we have tried to eradicate parasites, and that yet when the next report you see it's still there. So there's a way to get rid of parasite. Okay, I give you a simple clue. You can actually have papaya seeds mixed with honey and drink daily or weekly. It will eliminate most of the parasites. But that is non-medical. Okay, but if the person is symptomatic, then I would not use that methodology. Okay, viruses is the other. Again, viruses like hepatitis and others. Question: when you see virus, how do you know it's hepatitis? Until and unless you do a blood test. So don't declare that that virus is a hepatitis. It can be cytomegalovirus. It can be herpes virus. It can be uh, so many other viruses. Okay, leave it at the moment. So you don't declare that this is this particular infection. Just say there is virus. Okay, post-virus means you have been recently infected or you have recovered from some flu symptoms. Then comes this food page. This is where most of us will tend to neglect. The most important factors here that influences on the food. How much time do I have? Two for 15 minutes. I have 15 minutes. I'm wrapping up this. Under the food, most important is the gluten. Under gluten, we have the wheat, rye, barley, spelt, millet is the most important components. Then you might find under food section, you will find alcohol, you might find beer, you might find liquor. This again affects the gut. Okay, so I have come to the last part of the discussion on what are the common things that appear in the gut. But let me go back to the alien intelligence. This is some things that you don't see. If you go down to antioxidant page, if you see superoxide dismutase, basically it means detox. But let me show you some things you have never seen before. And neither do most doctors. Neither do most people who are well versed with this. I'm going to do it blindfolded. Are you ready? Okay. I can't see. This is for airlines. Okay. SOD is superoxide dismutase. Okay, and it has got two components. First component is copper zinc component. The second component is manganese. Manganese comes in the mitochondria. This comes in the cytoplasma of it. So when you have SOD or superoxide dismutase, it has two similar molecules. So when you add two similar molecules, one has to be oxidized, the other has to be reduced. So the way it acts is oxygen plus, superoxide plus the superoxide gives you an oxygen molecule, and here it requires two molecules of hydrogen, and it also converts partly to hydrogen peroxide. Hydrogen peroxide is a very highly radical component, so it has to be eliminated by the body. So the way it eliminates is H2O2. It will be converted to two components of water, and it requires glutathione. So glutathione, when it adds, you're adding as GSH, adding it becomes GSSG. Okay, and the enzyme here required is glutathione peroxidase. This GSSG will be converted back to GSH using glutathione oxidase. In the glutathione peroxidase, it requires selenoids. cystine. So when we see a report like me, thank you, you can see still blindfolded. Yeah. If you are looking at a report, this is what I see. That is why I'm saying this is alien intelligence. And for that reason, I have developed gut supplements based on thousands of reports, thousands of human data, and I've developed these, and we have overcome hundreds of diseases in Malaysia. And it's only available in Malaysia. In New Zealand and Australia and other parts of the countries will be probably coming in before May. But for the moment, it's in Malaysia. So it's one of the components. Someone asked me this question. What are the components in this? Very simple. You open up my brain and you see this formula there. Okay. Somebody says, challenging me what? You try to do this blindfolded first, right? So based on thousands of reports, I have developed this, and I knew exactly how much to be given, how much has to be done. Same thing. This is one of the components that is required for reversing diabetes and hypertension. And this is one of the components. This means there's a massive oxidative stress going on in the mitochondria. This is in matrix of mitochondria. This is in the cytoplasma. I can bet you can go on YouTube, Google the whole world. You'll never find some doctor or somebody blindfolded doing it. They'll write prepared notes and they'll tell you. So for that reason, I've developed an RK5 system that involves reversing diabetes step by step. So I'm very glad that I've come to the first half of the training process of what are the changes that goes on in the gut page. So we are going to have a 3 minutes break. After the 3 minutes break, there are a few things that I want to discuss with you before I go. If there's any question, please, it should be the current topic. Second is, I have developed a system called RK system. Okay, RK series. So what you're seeing here is for a restore. It can be RK diabetes, RK hypertension, RK fresh, RK gout, RK pain, RK multivitamins, RK skin, RK for male and for female. I've developed more than 15, right? Based on hundreds of tests that I've done. Okay, for example, you take RK fresh. I can tell you, you can take a sachet like this, and it has got SOD. Okay, and you can have 5 glasses of wine or 5 glasses of beer and have another sachet before you sleep. When you wake up next morning, you have 0 hangover, right? It'll be coming as RK fresh. So I want to stop here, take a 3 minutes break. Please understand, the moment you blink, you lost information. Okay, there's no repeat. This is a 4-hour topic. And I want to thank you. I've given you 3 minutes break and I'll come back. Thank you much. Okay, what I actually want to explain to you is the methodology of managing gut. Are you ready with pen and paper? So let's say a person comes to your presence, or you're facing someone with having a gut problem, and they will present to you maybe bloating sensation, bad flatus, burping, they eat little, they feel full, bad gastritis, bad breath, okay, and frequent stools, maybe bloody stool, bloody mucus stools, and that will be presenting symptoms or whatever it is. So how I teach doctors is to how to approach these patients practically. So I'm going to give you 10 steps, simple 10 steps, how to approach a patient. The difference between you and me, I'm a doctor, I'm licensed to examine patients. You will not have the same approach because I'm not sure whether you're allowed to examine patients or do a per rectal examination or a breast examination or abdominal examination. Okay, step 1. In managing, gut is taking a detailed history. detailed history. Ask them what is the presenting signs, what is the presenting symptoms, whether what food they are intolerant to. You ask family history, you ask medical history, whether their parents have it or grandparents' history. So you can track down what's happening to them. Let's say the parents having a gluten intolerance, maybe they are unable to tolerate a gluten. Okay, very important. Or just ask them their sleeping habits, their eating habits. And we will be able to pinpoint without even examining them. For example, I have patients who specifically say that, doctor, if I eat this particular food, I get a lot of gas formation in my tummy. Doctor, I'm eating very little food, but I feel full. I get a bloating sensation. Or they will come and tell you when they drink wine or alcohol, the next day they feel very lousy. They are unable to recover. Or they will tell you, doctor, I got a lot of pimples going on. Okay. So the number one, most important factor will be a detailed history taking. Okay. Step 2. So I'm showing you live on Zoom video to Australians and the people in New Zealand. And I have no notes. All my notes are here. Okay. What is step 2? Step 2 is physical examination. So as a doctor, we are allowed to examine patient physically. So we look for, what are we looking for from a person? As you're talking to the person, you got to observe their hair, whether it's dropping off, they're balding, whether they have pimples, whether they're asthmatics, okay, whether they're graying very fast or they look very tired, okay. Then we have to examine, what are we going to examine? Physical examination. We palpate the abdomen for a liver presence, whether there's an intestinal bowel overload, okay, or spleen enlargement, okay. Don't assume that something there is coming in the report and it's equal to a disease. That's a mistake you should never do, okay. Always do a physical examination, okay. I am, as a doctor, I'm licensed, and all doctors are licensed to examine a patient. I'm not sure about your side. If you're just talking, and then they take a report and assuming, is absolutely wrong by any medical standard worldwide. Okay. Step 3. So step 1, we have taken a detailed history. Step 2, we have examined the patient. Step 3. What is step 3? Step 3 is investigations. I'm not sure, as a nutritionist or whichever category that you are in, I'm not sure, because I'm talking to nutritionists and naturopaths in Australia and New Zealand. I believe we can do extensive tests in Australia. Okay, so what is the first test you do? As a doctor, we will do total white differential count. We do liver function tests. We do urine tests. Apart from that, tests related to the gut. The one test that we can do for the gut will be to know the person is having leaky gut or not. The gold standard for leaky gut is called CDSA. CDSA is comprehensive digestive and stool analysis. This will give you a diagnosis of leaky gut. Leaky gut is a primary to a secondary. It's a simple language for a person to understand. So if we are thinking about, let's take toxic metals, then we send for toxicology. We can either use urine tests, blood tests. If you're thinking about virus overgrowth, For virus, you do PCR. Okay. Then if you're thinking about some inflammation, mucus inflammation or mucus stools, we have to send the stools for not culture and sensitivity. There's a bacterial panel. There's a stool panel that we can do. Okay, and that is very advanced. One of the other things that is going on, maybe in the there's a chronic inflammation going on, we can do calprotectin, calprotectin, I think, proctectin or proctectin. Okay, I can't remember. That shows you whether you want to do a colonoscope, yes or no. Okay, do not. My advice, when you are touching on some chronic diseases and you're treating nutritionally, you will not know there's underlying cancer going on. Okay, for that reason, you manage what you can manage. And if you think there are no changes within the 3 months period, I seriously think you should be handing over the patient to a doctor. The person require more investigation like colonoscopy, maybe an ultrasound, okay, other investigations, okay, whether it's a gluten problem, you would not know. We cannot base it on a report. So the report tells you some things. Don't equate it to a disease, okay? And then we can do what you call zonulin ELISA tests. There are so many tests that you can do to make a diagnosis of a leaky gut or a gut problem. If it's a parasites, you need to send to the lab to find out what parasites you're dealing with. So it's very important. This investigation is a step 3. So step 1 is again history taking. Step 2, physical examination. Step 3 will be investigations. What is step 4? What is step 4? So now we have established what is the problems going on. Okay, we have seen gut has got alcohol, there's a liver changes, there's toxic metals. The first thing that we need to tell them is lifestyle changes. The biggest problem I find is, you see toxic metals, they're not willing to give up smoking. Okay, you see toxic metals, maybe aluminum toxicity, they're not willing to change their cooking ware. Okay, everybody wants to go to heaven, but nobody wants to die. Same way, everybody wants to be healthy, but they're not willing to compromise on certain things. That is the first thing we need to do. Lifestyle changes. Very, very important. I do not know how to emphasize this. They want some form of shortcut here, there, and they say, and they challenge you. And they will take advice from you in the front, but they'll continue doing the same thing again and again and expecting different results. And they expect the next test to change. And they'll put you in a corner. They'll challenge you. This is the biggest problem with humor, all humans are the same. So lifestyle changes is step 4. Step 4. Step 5. What are the other lifestyle changes? You need to cut down alcohol. If you're taking whiskey, you're taking rum, gin, what else, vodka, please convert it to wine, maximum 2 glasses, right? Or you wait my restore to come down to New Zealand and Australia in the future, and it'll help you to protect your liver. Okay, that's the other way. Okay, and there are 25 components. Okay, I can take a bet that after taking alcohol, when you take the restore, which is there in here, I'll open up for you, and there are 5 capsules in this. Okay, can you see the 5 capsules? Okay, sorry. You can go to the police, they blow the breath analyzer, they cannot detect alcohol. Okay, it took me 5 years to develop that. Okay, Uh, the other lifestyle changes, cut down sugar as much as possible. Sugar converts to alcohol. Sugar increases inflammation. Sugar decreases your immunity. Okay. If they're not willing to do all these lifestyle changes, it's almost very, very tough to correct a disease. And this disease or whatever the ill health may be there for 10, 20 years chronically. A person, biggest problem, 80% of the world problem is from the gut. So when they eat all this kind of junk and they have reduced the immunity and they're asking you to correct within a month, it is something which is ridiculous. So when a lot of patients come to see me, I tell them it will take between 2 weeks to 6 weeks to see a change. It takes 3 months to see a proper change. It may take 2 years to get you over a disease. Okay, so most important is the lifestyle changes. Next, after this, what do we do? After the lifestyle changes, the fifth step, in the investigations, we can also do food allergy tests. Okay, and one of the tests it pass in 15 minutes, you get a report is the S-drive. One of the investigations which I find is a comprehensive. It gives you 100 indicators and it's extremely fast. The blood is for more refined way of looking at exact specifics. For example, you found toxic metals in an S-drive report, and then you and I can do specific oligoscan, urine test, or blood test to find out what toxic metals. One of the physical examination you should never miss that every person that you're looking at is to open the mouth and look for amalgams. Okay, and do not remove the amalgam immediately. You have to send him to a biological dentist. It's a specialized dentist who will take care of the amalgams. Not immediately. We need to remove toxic metals first before doing that. Okay, then if they're eating big fish, ask them to eat smaller fish because big fish got a lot of toxic metals. Step 5 is replacement. So what is the first thing in the replacement? It will be pre and the probiotics. Okay, I think in Australia and New Zealand, we have fantastic probiotics and prebiotic. My prebiotic is different. My prebiotics in my Restore supplement is called Almuna and Al-Tayabat. Okay, some of them use all these vegetable and fruits as prebiotics. Okay, and that is the food required for the bacteria. For probiotics, you need certain specific bacteria to replace the bad. But before we do that, if in a report it shows bad bacteria, you need to replace the bad bacteria first. So if you look at a report in the gut page, you can see what is the specific food that you need to eat to overcome these bacterial infections, like berberine, coconut oil, so many things are there, garlic. So it helps you to overcome the bacteria, bad bacteria. If not, you're feeding the bad bacteria. It's only after that that you add prebiotic and probiotic. Okay, then you need to clear the gut. Okay, you can see you can clear the gut. Then we add digestive enzymes. Sometimes you have to add pancreatic enzymes, and then we need to add anti-inflammatory food. Please Google what is anti-inflammatory food. Like curcumin is an anti-inflammatory food. Omega-3 is an anti-inflammatory food. Okay, so I'm just running very briefly because this particular gut page or gut health is a 4-hour topic. So in Malaysia, where I'm training doctors, we do a training and the doctors bring the reports, not like these reports, and they'll present the case history and what this patient has undergone, all the investigations, and then we do the S-drive report, and then we go through one by one what are the things that we need to do, and we are very specific about what investigations we do, and that is how we discuss 10, 20, 30, 40 cases in a row, interactive, 2 ways. So when we do that, we are very clear of what we are doing. This is one of the tip of the iceberg. This is just a glimpse of what we actually do. Okay, then you add immune enhancers. Okay, immune enhancers. All of them are in my gut restore. Okay, there's intelligence in it. So immune enhancers is like what? Go and see. Go and check out. Google and find out what immune enhancers can you do, right? So that is step 5. How much time we got? What's the time now? 3:15. We are a little bit ahead of time. Step 6. Don't presume that everything that you see on a report is nutrition. That's the biggest mistake you could be doing. And if you suspect that it could be a family history of cancer or ulcerative colitis or Crohn's disease, diverticulitis, it could be cyst in the kidney, it could be a hemangioma in the liver, you would never know. So no matter how much correction you do, let's say you've done a 3 months correction and there's a slight improvement or no improvement, you can take it for another 3 months or 6 months. After that, this person requires a medical intervention. Okay, I've seen myself personally, I have fatty liver. In our mind, we look at fatty liver as a perfect liver. We have a picture of a perfect liver. That's what most of us have in our mind. Years later, when I done my ultrasound of my liver, and I found I was having a problem called hemangioma, abnormal blood vessels. So I'm born with a few physical abnormalities. That is one of them. Okay, if you give me 1 glass of wine, probably someone has to carry me after the 1 glass of wine. And I thank God that I've developed this. Now I'm protected. Okay, so don't assume and presume. If you have a vague suspicion, please, a doctor is more important to that person. You are handling life. You are a group of very specialized people. And what I love about you are inspiring and you are giving someone a life. Okay, when you're giving someone a life, we should be fair. No, you should treat someone with your soul and your DNA. You cannot be taking that equals to this equals to that. It does not work that way. This is a 3-dimensional world. I'm a 3-dimensional person who looks at things at 3-dimensional. That is why exactly I said that I have alien intelligence, and I've proved it to you again and again, right? And so the medical procedures can be in the forms of treating this patient can be in the form of injections. Maybe he needs a scope. Maybe he needs a colonoscopy. Okay, medical procedures can be including detox. Okay, detox in a sense of intravenous way of clearing out. Previously, I've actually explained to you how to do detox, like with using a little bit of probiotics and NAC. That does not clear totally. It just gives you a slight relief. Okay, so medical procedures are important. Sometimes you need to do ultrasound scan, okay, CT scan. Okay, you may be seeing some certain deficiencies, and it could be a pancreatic cancer. Okay, so it's a responsibility. I'm standing in front of hundreds, so many of you, and it's a responsibility. It's not something that this equals to that. It's a responsibility, and people trust me as a doctor to give them a life. So I rather tell them the truth rather than to have a flowery words about this and that, you'll be okay. No, it's not that. We have to have evidence, right? What is step 7? Is detoxification. Detoxification means it can be coming in the form of fasting. So you can have intermittent fasting. It helps to detox. You can take activated charcoal. It helps to remove toxic metals from the bladder. It can be in the form of coffee enema. It can increase the glutathione. It can be in the form of intravenous drip called Mayer's infusion. Okay, I'm not sure whether you are allowed to do all these, like intravenous or invasive procedures. Or you need to have chelation using DMSA or EDTA. and they have to go for 30 sessions. Or you might be asking them to go for a regular colon flush. I would not know what methodology you use. Or we may go for a high dose of vitamin C infusion, okay, to help to clear out. No matter what, when it comes to detox, please check them out. The amalgam has to be cleared sooner or later, one time or another, okay? And among the whole lot, okay, then the other foods for detox, like you can ask them to take celery, or you can ask them to take garlic. It clears out mercury. Then you can ask them to take carrots. Okay, carrots. Then somebody said parasites. Parasites have got many ways of clearing. One of the small ways is taking papaya seeds with honey in it. That's one of the small ways. Parasites are something that's extremely difficult to get rid. Most of the time we give medical management to come out. You can give coconut oil, you can give berberine. Okay, you go back to the report, you can see behind. Please do not take mine as a holy truth. You need to investigate. You need to go through some of the things that you're seeing. You need to read. It took me many, many years. I'm a medical trained doctor to come into the nutritional type. It's like I'm changing my brain. So don't take advice from here and say, this is it. There are many methods of treating parasites, or many methods of treating fungus, many methods of treating bacteria, okay? But in spite of your best management and it's still not coming down, then I seriously think you either work along with a doctor who will tell you what to do, because some of them needs prescription. For example, you have fungus. Fungus is not going to come out so easily. Like I shared, it may go into the mucus and cause a lot of inflammation. Okay, fungus, when you treat it, develops something called a biofilm. Biofilm. It will protect itself and they become resistant to your treatment. Okay, biofilm is the way fungus protects itself. So we cannot say this is my way, right way or not. Question, when you do the next test, would it appear yes or no? The patient definitely will ask you, doctor, if I take, it will be better or not. So do not have one methodology of treating, you have to have a few methodologies. So the fastest way, what I have done is, with the intravenous, is to use my formulation, which is called RK Restore. The word is, for detox, is RK Restore. This is a series I'm bringing in called Radha Krishna Restore. And there are 25 components which has been carefully balanced. It took me 5 years. So it helped to overcome a lot of problems from autism, Crohn's disease, ulcerative colitis, hemiplegic, what else? Toxic metal toxicity, chemicals. We have overcome heart problems, diabetes. What I found in the end, that it addresses a few issues, which I'll come to the last part. So after doing the detoxing, what is the next step? Step 8, the principles of management comes to this. Look for what you call the root cause. Don't look in parts. Look in the whole report, look for what is the root cause. And go after the root cause. These could be the direct problem causing other minor changes. You cannot say, oh, I want to correct selenium, I want to correct vitamin D3. No, you have not gone and cleared out the toxic metal. The toxic metal is causing this deficiency. So if you are doing parts, then I think you need to come back for second training, third training, fourth training, fifth training. I got doctors that come for 30 trainings because this is a new field. Okay, so look for a root cause, one or two things that can clear out. So as like, for example, amalgam. And we are telling to avoid gluten and they're not avoiding it. Gluten doesn't mean that you're eating rice and the pasta. No, it also comes in biscuits, in toothpaste, in cookies. So it takes education process. And not everybody has to avoid gluten. That is the biggest myth. 10% are gluten sensitive, 1% becomes celiac, and 90% are okay. So don't make a blanket ruling everybody has to overcome gluten. So, but if you have an intestinal problem, even if it doesn't appear on a test, we will advise them to avoid gluten for 3 months, and let's see. Okay, these tests it didn't show, maybe the next test it will show. Root cause, okay. The next, what is the long-term maintenance? What should we do long-term? I tell as a nutritionist or a naturopath, you have a specific timeline. And if it's not, this person may be coming to see you with a 30-year problem or a 10-year problem or a 15, 20 years problem. And you give yourself 3 months to 6 months. And if it's not becoming better, you're liable to the patient. Please refer to some specialist. Sometimes I get a call to say that person had a heart block. Unless you attended my training through called RK5 where I reversed heart blocks, do not. If the patient were to die in front of you, don't blame the report, blame yourself. Extremely important. This is medical legal issues. So nutrition plays a very important part. There is a stop where we can do. Okay, long-term maintenance, like what I do is we have all the investigations and we are very, very specific about evidence-based. And that is why I train them in 5 steps, how to overcome. This will be digitalized in the future, what specific food to eat, based on the reports I've seen. For example, diabetic, you eat zinc-related food, zinc-rich food, chromium-rich food. If you have a heart problem, CoQ10-rich food, L-carnitine-rich food. That is how it has been stepped in step 4. There are 5 steps to overcoming diabetes, 5 steps to overcoming hypertension, which will be launched worldwide very soon. Once I get these supplements approved in each country, then I will come down and teach step by step. Until then, probably you have to wait for me. Okay. So what is the objective of doing this report? And what's our objective of overcoming health issues? Number 1 is avoidance. That should be avoided. We are correcting at the cell level nutrition. Okay. We are reducing chronic inflammation. We are treating infections. We are healing and repairing the intestines, build immunity, remove toxic metals and chemicals. We need to do corrective of the hormones. Gluten. If you're not sure of all this, please ask a doctor. So I have a 30 minutes rundown. So let's say you manage the patient for 3 months and the 4th month you can repeat a test. What is the objective? Okay. Now I will tell you how to do it. Very simple. When you first see the patient, you go to page number 31. Remember step 1? So I'll take you back to step 1. Detailed history taking. Detailed step 1 is already given in the report. So just ask the patient to sit there or a client and ask them to tick. So that the 2nd month, they have already given. Day 1. Day 1. Somebody has intelligently marked it out. You just have to tick, tick, tick. Then 30 days. Can you see 30 days? This is the most important. So this is called subjective changes. So the person can symptomatically tell what is the problem with adults and a child. The adult will never tell they've improved, but the child will innocently will tell you, "Oh, I've improved these." So to prevent this, you got to be a person who can see in detail. So you just ask them, never show the first page. Okay, when you're doing 2nd time, don't show the first page. You can do comparison. Then after 3 months, you have another checklist. 60 days. So you can see how much the person has improved month to month. And in an event after 3 months, 4 months, or 6 months, you have a 90-day. It's all related to the gut and the health and the energy. There's no brainer at all. So after 90 days, he wants to see any improvement. Don't compare the first report and the 2nd report. That's absolutely wrong. All I find is if you have huge amount of toxic metals, let's say toxic metal is full. And I want to do a report to see whether it's reduced. Because your food habit changes in a month or 3 months, and so many changes can go on. So don't do like blood tests comparing these. Blood test is 2-dimensional, this is 3-dimensional. That's very important. So objective changes. Let's see, what is objective changes? Objective changes means in relationship to the blood test or urine test. Okay, we have done, let's say, homocysteine levels. So we are doing another homocysteine, or inflammation called ESCRP. So we look for ESCRP, whether it's reduced. That gives you an objective changes. So here is already well written, so simplified, anyone can sit down and answer. I find it so simplified. Okay, I'm not taking you on internet to show you something different. So the whole improvement is done in 4 months, 3 months to 4 months, and you can repeat another test. Okay, so I've basically finished on gut page. So I think Aaron has a surprise for me. Okay, so I'm going online. I'm not sure who's going to speak to me. And I think Aaron or whoever it is going to unmute and going to ask me a question. And you got to speak loudly for me to hear.
Yes, my friend. How are you?
Fantastic. Good. Aaron, nice to hear from you. What's the time in New Zealand?
It's wine time.
I'm coming in.
Yeah, mate, it's 8:30 here at the moment. So, but absolutely fantastic so far. Thank you so much for taking your time. But look, yes, look, I'm sure you're used to being put on the spot, so I'm going to do it again. Kerry's on the call at the moment. So, Kerry, if you don't mind, please sharing with Radha the particular details of a report, just the basics. And then what Radha's going to do is do a his normal rapid interpretation. So okay. If Kerry's there, if you can please, if you can please unmute her so she can just share the information quickly, and then we can carry on.
Okay. Is she on? Hold on.
I'm not sure. Are you there, Kerry?
Where's Kerry? Put up your thumb so we can see you.
I hope so. She was having internet problems. She's just here.
Yes. Kerry, before you go, unmute her, please. Okay, Kerry.
Hi, can you hear me?
I can hear you. Hold on first. I believe you're going to read me a report.
Yes, I am.
Previous time when I did a live session Zoom to New Zealand and Australia, I said I will decode it in 20 seconds.
You're on.
I could blindfold myself, and I don't have any report if you want to. The speed that you read is the time that I've decoded. So if you take 1 hour to tell me, it takes 1 hour. If you take 20 seconds, it's 20 seconds.
Okay. Do you just want me to just literally read through the pages?
Yes. You don't even send. You just read through the report. Okay, you have in vitamins what deficiencies, in minerals what deficiencies. That is all I need to know.
Okay.
Ready. So anybody want to put on timer, you can time me out. But the timer is based on what Kerry is trying to tell. If Kerry
all right.
1 minute, blame her.
Are you ready?
Yes, I'm ready. Okay.
Okay. Frequency interference indicators priority. ELF.
This is all there. Next. Vitamins.
Next. Okay. Vitamins. Consideration D3, vitamin C, B9, B12.
Okay. Next.
Minerals. Consideration boron, iron, iodine, potassium, sulfur.
Next. Sulfur. Okay.
Fatty acids priority. Omega-6.
Next.
Antioxidants priority. Alpha lipoic, vitamin C, polyphenols, flavonoids.
Next.
Amino acids priority. Serine, ornithine, carnitine, methionine. Environmental challenges nothing. Resistance, consider fungus, parasite.
Can you go back to environmental challenges? What do you have?
There's nothing, it's clear.
Okay. So parasites, none?
No parasites, fungus.
Okay, next.
And food restrictions are goose, onion, blackberry, avocado, dates, green grapes, corn, garbanzo beans, currants, and rhubarb.
I've already translated. How much time did she take to tell you? Can I go through that for you? I'll decode it to you. Put me live now. Okay. So the person is having methionine deficiency. Can you put it to me? Okay. The person is having methionine deficiency. Methionine converts to homocysteine. Homocysteine can convert to methionine and it requires betaine, and your test shows betaine deficiency. It also shows B9 deficiency, sorry, B12. Am I right? That means methionine cannot convert to homocysteine, homocysteine cannot convert to this. This is fatty liver. It means that this is your blood vessels. Your homocysteine is accumulating here. Okay. And on a long run, you might develop a heart attack or it's causing inflammation. This person can be hypertensive. B12 is required to reduce homocysteine. So most likely might go into a hypertensive or a diabetic. Okay. Have I done this? How long did it take? 20 seconds. All I need. Can you put back carry? Where you carry? Show me your thumb. And put Aaron 2 on.
Done.
Any doubt?
Fantastic, mate.
Okay. You can
Yeah.
blindfold me, I can tell you. So the intelligence is here based on thousands of reports. So what we generally do in Malaysia is that they will run the test with me. They'll tell you, they don't even send me the test. They read it out. I can tell on the phone. Done. As you're telling a history, I can tell you what's going on underneath. Okay. Any other questions that you have before we call it a day? How much time we have? What is there in the mineral again? Can you repeat okay, you have iodine deficiency. You have iron deficiency. Am I right? Can you unmute, Carrie? In the mineral section, you have iron.
Yeah. Iron and iodine.
Iodine. Okay. So iodine means you're subclinically hyperthyroid. Iron means there's oxidative stress. Okay. And you have alpha lipoic acid.
Mm-hmm.
Means it's trying to detox something. Even in the absence of toxic metals, there could be a presence of toxic metals down there. Something is causing an inflammation. So the body is coming out and asking vitamin C to take on. Okay. So in the mineral, what else do you have? D3.
Yeah, B9, I think.
B9. Okay. So you remember Audi car? Audi has got 4 rings. This is vitamin B9. This is BH4. This is urea cycle. So under urea cycle, in your test, you have ornithine. That means the liver is struggling. Follow?
Yeah.
Have I proven to you? You have any more doubts?
Didn't have any doubts in the first place.
You can get me up at 3 a.m. I can tell you too. And I'm not drunk. Yet, I'm protected by my restore. The intelligence in this. So someone asked me, what is the content? You sign a non-disclosure agreement, 100 million, then I show you. Or you need to cut my head to find the formula. We are coming to New Zealand and Australia probably in March or by May. So you enjoy your Christmas first. 2 minutes. How much time do you have?
Any more questions, and then we can have
Any more questions, and then we can celebrate Christmas and have an early night. Any more? I'm waiting.
Can I just ask about the omega-6 deficiency? Can you explain I didn't understand the pro-inflammatory. So if you've got deficiency in omega-6, what does that actually mean?
Okay, it's a male or female?
Female.
Female. Omega-6, you know evening primrose? Do you know evening primrose? If you go down to stores in probably in New Zealand, you have H2K, Australia, I'm not sure. You have evening primrose. It comes from omega-6. It could be a hormonal imbalance. Okay. Like I said the whole time, don't take one indicator and equal it to do a disease. You have to look at the overall picture. A person having omega-6 deficiency is good because it's not causing any inflammation. Okay, again, I'll re-emphasize this question. Omega-3 is anti-inflammation. Omega-6, if excessive, again, is pro-inflammation. So if you have deficiency of this, you don't have this, not a problem because you're protected by anti-inflammation.
Thank you.
Any other questions before we call it a night? Unmuting. Okay, so we are unmuting everyone now. Anyone can ask me questions. All of you look very shocked.
How do we contact you if we have a question? Can we email you or WhatsApp you or?
I think we need to go back to the person who introduced you because I don't give a contact because I've got personally I'm in a hospital, so email the company or discuss with the person who invited you for this. Are you okay with that?
Yes, yeah, Terry.
Or you want me to do another blindfolded biochemistry for you?
Yeah.
Any more questions?
Just a question, Dr. Radha. Sorry, my camera is not working. I have heard that people who are premenopausal, they are asked to take evening primrose oil.
Yes.
What is the connection between that? If it is pro-inflammatory and they are having hormonal imbalances, I don't understand what is the connection there.
High omega-3 post-menopause. Because post-menopause is a hormonal problem. You need to correct that. You need to see a doctor for that because you may have bone changes. You may have progesterone, estrogen decreased. Your follicles may not be releasing. This is just to help you to prevent, because once your hormones are gone, you have other problems coming up. Always I've explained this to everyone that do not equate a deficiency to a disease. For that, you need to see a doctor to understand because this is too big a subject.
Okay.
I hope I'm sorry, I can't give you the whole answer because I'm very careful about talking about diseases and equating it to something. I need to have evidence to show the blood test of hormonal balances. Hormones first. Yes, any other questions? The last questions before I say Merry Christmas to you.
Hi, Peter. Can you tell us just about the deworming? Should you do deworming before you do any vitamin program, or can you do it in conjunction?
You can do it in conjunction.
Okay.
Because it is not the main thing that is causing a problem. For me, when we are reversing diabetes and hypertension, we clear out the gut. Because inflammation causes gut problem, causes liver problem, it causes heart problems, it causes so many other problems. It feeds. And what I do is you can do in conjunction with it and get rid of it.
Okay, and what do you recommend is the best deworming system? Should you do it just by natural foods, or should you take a pill?
Natural foods, you must be better than me. I'm a doctor. So for me, it'll be Zental or albendazole with flagyl,
Right.
because we want to clear things fast.
Mm-hmm.
Okay, if we were to go in a non-medical manner, nutrition, it will take time. It will clear, but it will take time.
Yeah.
Okay, and I have no time on that.
Mm-hmm.
So I stop here.
Thank you.
all.
Thank
Merry
you.
Christmas. I'm Dr. Radha Krishna signing off. I'm
Thank you.
inviting.
Thank you very much. Just say there, thank you all again for joining us. And I'm sorry it's so late for you all, but it's wonderful to see you all enjoying the special man who I'm glad we can call a dear friend in cell wellbeing. He's an absolute genius. And as you know, we trade in 67 different countries, but this man is near the top of the list. And his team developed the Get page. Thank you all.
Thank you.
God bless. Stay well. Have a super Christmas, a very prosperous, healthy New Year. Stay well, everybody. Bye-bye.